vocation. That vocation is medicine, right? In a way, right? Jesus Christ being the great physician that he is, this is a way to follow his footsteps. It's obviously not the priesthood, the greatest way to follow in his footsteps, but it is a way that, I feel that God has called me, to imitate the life of Christ, and in that way. However, we're also here because I think we all see that medicine, or at least mainstream medicine, is, for lack of better, it's horrendous. Both on a temporal and on a natural and a supernatural level, right? You look around in America, and I don't think we have ever been sicker, right? When your grandmother was growing up, how many people around her were going to the doctor every month, every 3 months? How many people were obese? How many people had diabetes? How many people were, just finding cancers all the time? Things like that. William Osler, a very famous physician in the early 1900s, said that, he could count the number of heart attacks that he had in his entire career on 2 hands, right? So the last century has been a century of complete decline with respect to medicine's ability to keep people healthy. And a lot of that has to do with essentially lifestyle, which, dirty secret, you get about like 1 or 2 days worth of training in medical school. So when you have your doctors telling you, spending 5 minutes with you and prescribing a pill, well, a hammer is only going to see a nail. So if someone is trained to prescribe medications or to do surgery, their first inclination to help you will be meds and surgery, right? And the problem is that medications are, in a lot of ways, very few medications actually treat root causes of diseases. In fact, a lot of medicine is based on risk factors. You hear risk factors all the time. There's a risk factor for this thing, there's a risk factor for that thing. There's all correlations. And you see these studies. Oh, coffee increases your risk of this. Oh, but it also decreases your risk of that. Medicine forgot at some point that there are causes to things. And in a way, it also forgot that we are created by God, which means we are not broken in the sense that we were built broken. There are the wounds of original sin. But the wounds of original sin are not cured by Ozempic. Right? We do not have a blood deficiency. We're not born with that. Right? But that is how medicine ends up being practiced on an actual level. Right? How many people, if you have chronic pain, the first thing is not, here's, the exercises or the strength training you need to do. No, here's some ibuprofen. Right? Hopefully not, but you also see this. Here's some oxycodone. Right? Or here's steroids, right? For your osteoarthritis. Again, it's just how many people will say, well, it's normal to be on 4 or 5 minutes at XYZ age. Or, being on med for blood pressure, it's a normal thing. That wasn't a normal thing 100 years ago. It wasn't. So you see this, almost this, how should I say this? Almost making excuses for the failures of modern medicine by just lowering the standards, right? It is the biggest rate of low expectations in that regard. That if everyone becomes sicker, we can just reduce the standards and saying that there's a real failure. And on a supernatural level, right? We see that medicine is absolutely off the rails, right? People who have experienced OBGYNs after giving birth saying, well, what kind of contraception do you want? Right? Or, would you like your tubes tied if you were in the middle of a C-section, right after a C-section? Right? There's no thought there. There's no thought about what the purpose of a woman is, right, in that regard. To just casually offer these things that change fundamentally your role that God has given you as a person. You look even more deeply, in the last few years, certain things that were pushed on people, certain things that were coerced, right? That in no good conscience should have been done. And then you look at, in a weird way, so how I was saying that we lowered the standards, right, for some disorders is almost normal. And now, simultaneously, disorders are being elevated to something that needs to be affirmed. And, you know, if you don't like the direction that medicine is going in, right, with respect to both the natural and the supernatural, well, if you look at, if you want to know who's running these universities in 20 years' time, you just have to look at the kids who go to Yale, Princeton, Harvard, because those are the people who end up running those institutions. If you do not like the morals of those people now, you will not like them in 20 to 30 years when they actually control these institutions. So where does that come in for me as a physician who not only wants to be a physician and actually help people, but also doesn't want to lose their soul in the process or help other people's or aid in the other people losing their souls as well. So you're not going to find much help if you end up being employed for a hospital or a major group, but as the regulatory environment is and how medicine is, it's becoming increasingly more centralized. So you end up having to strike out on a path of, you know, kind of running your own practice. Now that doesn't mean you have to bankroll things. I work at a hospital in Lake City to make the bills meet until I can get this thing off the ground. But the model that you have to actually then take is one in which you are not beholden to companies, to insurance companies, to Medicare, to Medicaid, to all these influences that are going to push a particular style of medicine that we clearly see as ineffective. Just look at the numbers, right, in terms of obesity, diabetes, childhood diabetes, childhood obesity. I mean, there's, regardless of your feelings about the individual age, just the numbers don't bear out that their advice has worked for the past 40, 50 years. And then obviously from a Catholic perspective, you want any kind of, you know, sense of morality, you can't trust an insurance company for that. So ultimately, you have to be able to be someone who has their patients be the ones who makes the decisions on where the dollars go, right? Your insurance company ultimately makes the decisions on where the dollars go in a healthcare system. So that is kind of the reason for the direct primary care model of healthcare, which is a newer thing. It definitely got more in vogue after wasn't this a misnomer? The Affordable Care Act. In terms of that, that's often how these bills work. They slap a nice name on it, but it doesn't end up doing what it's actually, the name actually intends a lot of the time. And it's a model in which you and the physician don't have a middleman, right? So there's no one getting in the way saying, well, you got to pay this copay or that copay in order to see your doctor, or oh well, if we don't accept your insurance, I can't see you. You know, those kind of things. It also allows, from a running the business standpoint, the overhead becomes a lot less. You see in a fee-for-service practice, which is the term in medical terms, essentially a practice that takes insurance, has to essentially see a ton of volume in order to make the bills, because you don't know when the insurance company will pay you, you don't know how much they're going to pay you. And because of that, you've got to see volume so you have enough revenue, because you still have to pay for your office, you still have to pay for your employees, things like that. So in order to see volume, right, you're scheduling 20 patients a day, you're working a 9-hour day, how much time do you have to spend with patients, right? You go into any primary care office, count how many people do you see before you even see your doctor? Or how many people are working there for every doctor? Probably like 6 to 1, 8 to 1, 10 to 1. So you think, you know, you'll probably spend more time with the receptionist, the medical assistant, or the nurse. And maybe your doctor comes in for like 5 minutes and is like, oh, everything looks good, or we can talk about one thing today, and you'll see you in 3 months. Because all my slots are filled, because I have to keep them filled all the time. And that, I don't think, again, going back to the degradation, even if someone had an interest in lifestyle, getting people in the root causes, in helping people to get off medications, to get healthier, to be less dependent on doctors. If you only have a practice that allows you 5 minutes a patient, 10 minutes a patient, how much can you do? So the direct primary care model, by not having that, means that you can spend 60 to 90 minutes on a patient visit. No problem, right? You have flexibility. Do I need to worry about what I can bill for a phone call? No. Or a text? No. Or a video call? No. You don't worry about any of that. Whatever the patient needs, you have the ability to adapt to the individual needs of your the main benefit of that, right? And then finally, why the particular kind of interest in like low carb, ketogenic, carnivore diets, whatever kind of mold it is. A lot of, when we get to the root causes of what disease are, I think Ben Dickman wrote a great book called Why We Get Sick. And I think the ultimate thing is metabolic dysfunction or insulin resistance. Long story short, there are many paths to insulin resistance. The most common ones, I would say, are problems with sleep, chronic stress, right? To some degree, a sedentary lifestyle, but number one is diet. And a lot of it has to do with the fact that we are eating probably the worst diet in the history of mankind. I mean, you have some cereal company, I can't remember if it was Kellogg's or Post or General Mills or whatever, telling people to eat cereal for breakfast, or for dinner, sorry, for inflation reasons, you know? And that, unfortunately, this is going to be, you know, as inflation continues to go and people become poorer and poorer, like, we're going to see worse food choices. We're going to see more problems with disease with respect to the amount of sugar in the diet, the amount of grains in the diet, but also the amount of, like, essentially industrial sludge, which we call seed oils, which were originally industrial sludge. The first seed oil in America really was cottonseed oil, which was essentially, you take a cotton gin, you pick cotton, you take the seeds off the cotton, you press the seeds, and then you lube the machine with that. And then someone got the fancy idea in the South to cut lard with it to make it cheap. And that was the introduction of industrial sludge into the food. And then now it became canola, mazola, heart-healthy canola oil. You know, soybean oil, especially after, you know, Nixon took the American off the gold standard, the bread standard, led to soy and corn in every feedlot, and that's why every chicken is like 8 million pounds relative to what it should be, you know, and has, you know, breasts like it had plastic surgery. Like it's terrible what they've done to the animals, but we end up suffering for it because they essentially make the food cheaper and more accessible, which in some way can be a good thing if you're on the verge of starvation. That's not the problem in this country, because even the poor tend to have the highest rates of obesity, which is different than poor in other countries where they're actually starving. So you see that we've kind of broken our bodies through these habits and things that we were told that were healthy, right? Look at the original food pyramid, right? 6 to 12 servings of grains, maybe only 2 to 3 servings of meat, and most people are starving. They never tell you as you age, you actually digest protein less. You actually need to eat more meat in order to maintain the muscle mass that you have, right? You see people replacing proper fats that we were told were dangerous for them, like butter or clarified butter or beef tallow, or, you know, Crisco, margarine, exactly. You actually go to a hospital. You'll go to a hospital and you will see that they will serve margarine. And the reason for that is because it is low in cholesterol. Despite the fact that research has shown that there isn't really a diet-heart hypothesis link in terms of, you know, dietary cholesterol or dietary saturated fats leading to these issues. And that's pretty much been debunked. But it still persists, right? But what I kind of view low-carb or ketogenic diets or even carnivorous diets, which is just another form of low-carb diet, just a specific kind of thing, is that it allows your body to restore that metabolic health by essentially switching you over from burning carbohydrates, burning glucose, to burning fats. And people have found a lot of benefit with that. Not only in weight loss and diabetes, but with chronic pain. There's an excellent book by a doctor named Chris Palmer, who's a psychiatrist, who chooses ketogenic diets to even treat things like schizophrenia, bipolar disorder, and obviously the oldest use of the ketogenic diet is epilepsy, right? And how many epileptic drugs, well, if you're familiar, epileptic drugs are also used in psychiatric disorders. They're used for migraines, right? All these diseases that people, you know, getting back to root causes in medicine, you'll see all these different diseases that seem to have the same risk factors, but no one seems to put it together. I remember in medical school being told that PCOS causes insulin resistance. But if you put someone on metformin, which insulin sensitizes people, the PCOS gets better. And I remember asking a question in medical school saying, doesn't that seem like the opposite? And I didn't get an answer. I also remember asking one time, because we had a nutrition lecture from a dietitian, and it's just like, well, the diabetic has to take insulin, so he has to eat carbs so he doesn't go low with respect to his sugar. And then you just ask the question, right? Like, well, shouldn't you just stop eating the carbohydrates so he doesn't have to take the insulin? And they'll look at you like you have three heads. And it's these kind of things that, like, none of this is, I don't think any of this is actually that revolutionary. You look at like a Salisbury steak. Salisbury steak's been around forever. You know who Dr. Salisbury was? Dr. Salisbury invented the Salisbury steak to treat people with GI issues, if I remember correctly, with essentially an all-meat diet, and the Salisbury steak was a cheap way of doing that, an affordable way of doing that for his patients. So none of this is, the papers on like migraines, keto for migraines, or actually the ketogenic diet was the first treatment for type 1 diabetes before insulin. So none of this is new. None of this is a fad, in my opinion. It's just, I think, restoring order. All around us, I think we are surrounded by novelties. Novelties that, for whatever reason, people want to argue either have always been or are necessary now. Whether it's in the faith, whether it's in our lives, like with respect to our diets, or our, how we live, or expectations in terms of behavior or dress or whatever. It seems like the people want you to live a particular way almost because it's comforting. To know that, if it's bad, there's not really much you can do about it. And at the end of the day, I don't think it's anybody's fault because of how astray people have been led, that their health is a particular way. But what they should know is that they are in control. They have the ability to change things. But that means, for a lot of people, some people can do it by themselves. Some people there are people you'll hear stories of people with stage 4 cancer who are like, I just read this thing, and for example, ketogenic diets can be beneficial in certain types of cancers. They will do it much to the dismay of their own doctors, get better, and their doctors will wonder why. And good for those people. But a lot of people don't have that kind of drive against what they're being told. They need support, right? Not everybody is going to be, almost like Rambo and just be like, it's a one-man mission. That's not really how things work, right? That's why we have community. That's why we have family, right? We need support structures in our lives. So, in opening up this practice, my goal is to try to provide a support structure not only for people who want to get better, with respect to their natural ends, right, their temporal ends, but also to be in a place where they feel like, okay, this doctor is not going to force anything on me that is not Catholic, that is contrary to even natural morality, right? And we'll be honest, if I ever, if you, were ever to ask for something that turns out you just didn't know was immoral, instead of saying, again, affirming the patient, which isn't charity, right? Ultimately, we have to live with charity, and that means that you can't, as a doctor, look at someone just as a bundle of temporal ends or temporal needs, right? Granted, you're not a priest, right? No one is going to heaven because of me. It's not going to happen. I do not have ability to give sacraments. I mean, obviously, baptism, sure, like in a pinch. Hopefully, it never comes to that. But you can't subjugate the ends of the body at the cost of the soul, and that is why the practice is explicit in its morality, because I want people to feel comfortable with that they know that they go to this doctor, that they can have sound mind, that they care about them as a person with a body, but also with a soul, and that's enough. So that's all I have to say. If there are questions, happy to answer them. Yes?